it's for personal reasons or medical reasons, many people are waiting to have children. And a lot of those people are interested in ways to preserve their fertility. Dr. Jeremy Groll is here with some possible options for you. Welcome back to the show.
Well, thanks, Katie. Thanks for having me.
You know, as I understand it, there's been a lot of advancements when we talk about freezing eggs and things like that. Tell us a little bit about that.
That's right. And so for a long time, we've had male preservation available, and that's always been, very easy, very quick, and, for lots of reasons, whether guys have medical conditions, for upcoming cancer therapies, or say for high-risk employment. So certainly our military, fire, police, those are folks that if they're in those lines should certainly consider storage for future fertility options, so just in case anything happens. But for women, that's been much more of a challenge. Egg freezing is just technically much more difficult. They're very large cells, and so the freezing process took a lot more time to kind of work out the details. But that came off the experimental list about 2012. And so with the building of the world experience with egg freezing, that now that provides just so many more options for women and really has revolutionized their reproductive choices.
Sure, and you can talk about some of those options today.
Oh, absolutely. So if we have people again with say medical conditions and maybe they've got something that would threaten their ovaries, if they've got ovarian cysts or chronic conditions or like cancer, that we're able to retrieve the eggs and freeze them, and so that as long as they retain their uterus, they'd be able to carry a pregnancy effectively.
Sure.
But also really has opened up from many other aspects. So from the egg donation perspective, now we have actually egg banks like we have sperm banks, and so that allows people to pick out their eggs so much more efficiently, and so that they don't go through a lot of the frustrations and cancellations, and it's more cost effective as well. And so just has really made that process so much easier. But then, from the social aspect too, that a lot of folks, may not meet their, significant other or their partner until a later point in life. And so that way they can still, if they've got, family plans for down the road, be able to have those available options. And certainly too, as we look in terms of professional careers or education, that we have a lot more people delaying their, family plans until, later into the 30s or even 40s and 50s. And that this, gives people so many more options and choices. Yeah,
a ton of choices, really. When women have certain options and they want to know as they're navigating that process, we can come and see you and you can kind of really help us out in those areas.
That's right. And so at SpringCreek, we offer the full line of fertility treatment options and storage options. And with that storage, that it really is for an indefinite time period. So, that there isn't like a time frame that people need to use them within. And so that this way they can really look forward and have that opportunity. And that's really one of our biggest missions right now, is to make people aware of what can be done, because so many folks really don't know that these things are available until later in life or later down the road, and then might not be quite as likely to work or have as good of an opportunity. So.
Yeah, and you make a great point about sperm donation. Sperm banks were, really the thing that people did the most, and as they thought about egg donation, it may be a little trickier, more costly, and where things are changing. And
so that's right, and it is, certainly a lot more, logistically involved than say sperm donation or sperm freezing. But with that, there's a lot of different options and ways to go about looking into this. And so anybody who's interested, of course, to please let us know, and so that we can get the information they need and they can make informed choices.
Very great. You can let them know at their office there in Centerville. Visit SpringCreekFertility.com, and you can talk with Dr. Jeremy Groll and get some good answers for yourself. Thanks so much for being here.
Oh, thank you so much.